I would say there's been several studies, probably about almost 24 that have shown that PERT teams and these institutions have looked at before and after PERT, that they decrease time to diagnosis, decrease time to heparin initiation, which I already shared, early anticoagulation saves lives, decrease cost, decrease length of stay, and decrease mortality. So I want to highlight one that was just published recently out of the University of Rochester, looking at the long-term effects of PERT. They actually looked at the 6-month mortality rate, and it was 137 patients before and 231 post. And they saw that the 6-month mortality rate was 14% post-PERT and 24% pre-PERT, which is amazing. But what I want to highlight is the time, the triage to diagnosis was actually an independent predictor of mortality in this study. And they found that the risk of mortality was reduced by 5% for each hour earlier the diagnosis was made. So Dr. Muck explained that the AI is decreasing it by 75 minutes. That's already 6%. You've just decreased the mortality by 6%. And Dr. Golden shared how, there was a 3-hour delay from his symptoms to, or even longer, I think 5 hours from your symptoms to when you got diagnosed. So I think that, so PERTs have clearly shown that there's a decrease time to diagnosis and short-term and now long-term mortality. But really, if you think about it, that early diagnosis is so crucial. And if this can help get that early diagnosis where you can then start the early anticoagulation, or you can then decide whether you need the treatment, that's going to save lives. Absolutely.